So I tell my family and friends that I'm a radiation oncologist, that I treat patients who are sometimes very sick, sometimes near the end of life. And I would tell them that we treat them not only with the best technology, but also with genuine care for their situation and the care that they need.
I care about what happens with the patient, whether it be their health, whether it be dealing with their money, the whole patient.
There are two things that are the most important. Number one is that we have the technology to deliver care that is on par with our colleague centers, both around the state and the region and even the country. And the other is that we deliver care with utmost compassion, that we recognize that patients are more than just a diagnosis and that their treatment is more than just a beam. The first software that's involved in a patient encounter or a visit is MOSAIQ. We gather information from the prior physicians and other providers that patient has seen so that then we have synthesized a picture of what's going to happen in this patient.
SmartClinic has helped the workflow by making the assessments that we do on our weekly status checks a lot easier. Instead of having to go in and type out what the patient is saying, we actually have drop boxes, which makes that more efficient, and we have more time just to sit and chat with the patient versus typing up a document.
Adding MOSAIQ SmartClinic has improved our turnaround time on notes and documentation so that we're able to do many things in real time with the patient in the room without interrupting the feel of the patient visit for them.
I have commented several times on this staff. They are very professional, yet they have a personal touch, a personal compassion. You have a different atmosphere in this office, in this doctor's office, than any I've been in, and I've been in a lot of them.
MOSAIQ presents all of their essential information. Then we do a consultation with them, and after that, we bring them back for another visit, at which time we do a simulation. Let's say that she's a breast cancer patient. Let's say that we are doing respiratory gating, and that we're treating her prone, and this is an initial simulation, so we'll just say it's not a re-simulation. And then we can determine whether or not we want any of these special things. And all of this is customizable based on the center's preference. So then we move on to Monaco, our treatment planning system. Monaco enables us to devise a delivery pattern of radiotherapy that maximizes the dose to the tumor while minimizing dose to the normal tissues around it. Once we go through our checks and quality assurance processes, then we bring the patient back to actually start the treatment. And we're very pleased to use a state-of-the-art linear accelerator manufactured by Elekta.
I think the fact that most everybody on staff here has somebody in their family or somebody very close to them that has been impacted with cancer, we are 100% able to empathize with the patients. We can walk with them. We know how they're feeling.
I have lived through 3 grandparents that have dealt with cancer, and so it's close to my heart.
There have been several patients that have tugged at my heartstrings. This particular patient had inflammatory breast cancer. She fought a very long, hard battle. I miss her dearly. She lost her battle well over a year ago.
My motivation to be in oncology care comes from being the child of 2 oncology patients and seeing what they endured.
A cancer diagnosis is not just for the patient. A cancer diagnosis is for the whole family and friends involved with that patient.
It can affect their employment, it can affect their finances, it can affect their emotional stability.
While there is the sadness of some people, there are so many more happy cases where the patients ring the bell and they walk out, they're hugging us, they're thanking us, and they come back, they bring gifts years later because they're so appreciative, and that's what keeps us going.
GenXRT is committed to maintaining the high standard that we have today and to going beyond in the future. My vision for cancer care in Alabaster, Alabama is to stay current with the most exciting advances in radiotherapy and the most beneficial treatments available.
My motivation to be in oncology care is to help patients that are scared, they're frightened, and walk with them and hold their hand and help hold them up through probably one of the most difficult times they'll ever face.
Here at this facility, we are able to provide patients with cutting-edge technology through the delivery process of their radiation therapy treatment, and this equipment and software allows us to do that.
Our partnership with Elekta works because they realize who we are, they realize where we are, and they understand our goals. They want to help us achieve our goals. Where do I see us going in the future? I see us continuing our partnership with Elekta to make sure that we are delivering this superior care that we desire for our patients and for our community.